Somewhat related question, and I have two. One from Ritu, and I'm sure it applies to a lot of other parents and grandparents with young children at home. At what point of time would children get in the queue to take the vaccine, and what is the reason that they are not there or they're last in queue? So just some general thoughts on that, and then I have another very interesting one which I'll ask.
Well, one of the small good things about SARS-CoV-2 of the COVID-19 infection is that it doesn't cause, or so far hasn't caused, bad sickness in young kids. There have been some cases, a smattering of cases of multi-system inflammatory syndrome in small children, but most of the ICU admissions and deaths have not been in children, which is why the vaccine rollout has been towards the more vulnerable population, the older people with comorbidities. That's the reason why children are, still not in line. There are active studies going on looking at how safe and efficacious this vaccine is in children. And as those answers come, I think this will roll out to the pediatric population as well.
And if I may add, Dr. Vikramjit Mukherjee has two very young kids under the age of 5. So he speaks from that perspective. Dr. Chowdhury, did you have anything to add there?
No, I completely agree. And that is the only good thing. I think the COVID vaccine has a soft spot for children. Sorry, the COVID virus has a soft spot for children. It hasn't really bothered children much throughout our pandemic. And I think mostly children have been more spreaders rather than, sufferers through the pandemic. And I think as time goes on, we'll know how safe it is for children. And maybe then they'll be vaccinated, because most studies have been done above the age of 16. So it's time and studies that'll tell us how safe it is.
So this is a lawyer speaking, and I wish it doesn't happen, but it gets me thinking, considering the virus is mutating, it is a dangerous creature. What you just said could be completely turned on its head 6 months from now.
Yes, absolutely.
So that's a scary thought, and I think we should get to herd immunity as fast as we can.